I would describe Christy as enthusiastic, friendly, cheerful.
She really has just a spirit about her that makes you want to learn more about her, be her friend.
I'd say she's very outgoing, knows what she wants, and goes for it.
I've watched her in the last couple of years just really grow into someone who is a philanthropist. She is a giver.
Because of her outgoingness and friendliness, she has become way more community involved and done more things in a community than I ever would have thought of doing. And I believe it has excelled the dealership.
Once you give, you get that rush that you gave, and it makes you feel so good. Hopefully people will continue to do that. And I think that's kind of how Christy feels. I think she likes to help others. She gets a good feeling from it. She realizes how much that is needed in the world and how important it is to help others.
Karen, as I understand it, had some sort of genetic, and so it was a deterioration of kidney functions over time.
And knew that eventually I would need a transplant. And about 10 months ago, the time came that I needed it. And I was lucky enough to get a phone call because I was in the kidney transplant computer nationwide. And I was able to receive an extremely good match from a young man. And it's prolonged my life. I'm very healthy now, I'm very happy.
My son Grant Glazier was killed in a car accident in 2004 at the age of 21. He was driving, he had just left the house, 2 miles from the house. It was January 31st. And it was one of our winter nights where it's snowing and blowing. And he hit a curb, his car spun around, and he was hit from behind by a truck. We were told that Grant was brain dead and there was nothing they could do, and we could leave him on life support for as long as we wanted and pray and hope, or had any of us ever thought of organ donation. If you lose somebody and you're just grieving, it seems kind of senseless, but in the end when you donate their organs and you feel like, wow, they saved this person and this person, then you realize that it meant something.
I can remember a long time ago that Christy and I were together, and she goes, "Mom, I was at a CentraCare meeting and we're going to have a donation wall at the hospital." And I said, "Wow, what a great idea." There's a computer built into the wall where you can put in someone's name and find out, I guess, what was donated to them at one time and how it impacted their life. And it's just makes me feel really good that there is a wall like that, because it's very interesting and it helps promote people to be a donor, which is what Christy and I have been working on. And since my transplant, I have gotten many emails and calls from people that have said, "I'm a donor now, I'm a donor, thanks to you and Christy." So we really feel good about that.
I saw Christy Gilleland speak at the donor wall, which I helped work on, and knowing even they received, but they were so grateful and they wanted to share and help others to get the word out, because other people could be saved. And that's the reason I do it too, is just other people, other kids make a difference.
There's not a day that goes by at the St. Cloud Hospital that I don't walk by that wall, that there's not somebody standing there looking at it and watching the pictures of the people who gave flip, change, and they're almost mesmerized by the beauty of what's going on that wall.